everyone, I am Jessica Humamal, a second-year BSN student from Visayas State University, and today I'm going to perform newborn care. Okay, so now, knowledge. It is in this time that I will discuss the essential newborn care to be performed, the pharmacology of Crates prophylaxis, vitamin K, and hepatitis V vaccine. Also, I'm going to discuss the 4 newborn care practices, the unang yakap, which is according to DOH protocol. Okay, so now let me start. The proper positioning of the newborn within the 90 minutes of non-separation from the mother. Okay, so the newborn is prone at chest. Newborn's neck is not flexed nor twisted. Newborn is facing the breast, and its body is close to the mother's body. And lastly, the newborn's whole body is supported. So next is the pharmacology of Crates prophylaxis, erythromycin ophthalmic ointment. So it is a topical antibiotic and its dosage ranges from 0.5 to 1 centimeter each eye. And its possible adverse effects is mild irritation to conjunctiva, slight blurring of vision. And it is effective against gonorrhea and chlamydia organisms. Drug of choice for eye prophylaxis at birth is possible. And next is the pharmacology of vitamin K, phytonadione, and its dosage ranges from 0.5 to 1 mg intramuscular. And possible adverse effects is local irritation such as pain and swelling at injection site. And it is used to prevent and treat hemorrhagic disease in newborns, necessary in the component for the production of certain coagulation factors, and is produced by microorganisms in the intestinal tract. Next is the pharmacology of hepatitis B vaccine. It is also a topical antibiotic, and its dosage is 3 IM, 3 doses to be given at 0, 1, 6 months of life. And its possible adverse effects is sore leg from the shot and low fever less than 37.8 degrees Celsius. Now, the 4 newborn care practices according to DOH protocol or the unang yakap. So this is the step-by-step interventions in EINCR, immediate and thorough drying, early skin-to-skin contact, properly timed cord clamping, and non-separation of newborn from mother for early breastfeeding. So the unang yakap or essential intrapartum newborn care was really conceptualized in order to have early initiation of breastfeeding. So how early is early? It is as early as the delivery. The newborn is placed strategically on the mother's breast so he will be able to feed immediately when he is hungry. What's good about unang yakap is that it respects the readiness of the baby to breastfeed as manifested by feeding cues, and it is explained by Dr. Tichy. Okay, now that I have donned my surgical gown, I'm going to put the mask and cover properly to prevent contamination. And then the mask. Okay, so next is we introduce self and verify the client's identity, explain the procedures, so why it is necessary, and how can the client can cooperate to establish rapport and promote cooperation. Okay, so as we identify the infant, we use a name tag or a wristband. And we explain to the mother that all newborns require essential newborn care to minimize the risk of illness and maximize the growth and development. Next, we perform hand washing to prevent spread of infection. So now we prepare the needed materials. So we have here erythromycin ophthalmic ointment for eye care, vitamin K, hepatitis B, medicine dropper, 2 tuberculin syringes, aspirating needle, and wet and dry cotton balls. Okay, next we're going to check the hours of drug administration. So starting with the right drugs, so we're going to check and verify if we have the right name and form of drugs. To do that, we're just going to recheck the label of the medications we have here. Next is right patient, so we're going to check ID and on the ankle of the baby before giving the medication. Even if we know that patient's name, we still need to ask just to verify. Next is right dose. We're going to check the medication sheet and the doctor's order before administering the medication. And then right route. So we're going to recheck the order if it's oral, intravenous, subcutaneous, intramuscular, etc. Next is right time and frequency. We're going to check the order for what it would be given. So now I'm going to don gloves to prevent contamination. Discard the plastic cover, and then I'm going to perform closed glove technique. Okay, so now that I'm done donning my gloves, I'm now going to prepare and withdraw hepatitis B vaccine and vitamin K. I'm going to prepare this now so that I would not left the baby unattended later while administering this medication. So, I'm going to withdraw first hepatitis B vaccine. Okay, so 0.5. Okay, and then withdraw 0.5. Check for bubbles. Okay. Okay. So I have now prepared the hepatitis B vaccine for later. This card. Okay, now I'm going to prepare the vitamin K. Okay, so we're going to get 0.5 to 1 mg of vitamin K. Okay, then I'm going to withdraw 0.5 mg of vitamin K. Check for bubbles. Okay, so I have now prepared the vitamin K. So we have here hepatitis B vaccine, vitamin K, and the eye ointment for later. And then this card. So now I am ready to perform the procedures. Okay, so I have here now the baby, so I'm going to proceed with eye care. Okay, so I'm going to gently pull down the newborn's lower eyelid and then extrude a line of ointment the length of the lower eyelid from the inner canthus outward. Okay, then the other eye. Oh, baby. Okay, I'm going to discard the remaining ointment to prevent it from being used. Then I'm going to close the eye of the baby and count up to 5 to allow absorption of the ointment. And then I'm going to wipe away excess ointment from the child's face. Okay, the other side. And then discard. So I'm now done with the eye care. Next, I'm going to proceed for the hepatitis B vaccination. Okay, so now I'm going to perform hepatitis B vaccination. This is to protect the baby against hepatitis B. So I have here now the withdrawn hepatitis B vaccination. It is on 0.5 ml. So now I'm going to wipe the baby's thigh at the injection site with wet cotton balls. Okay, discard. And then now I'm going to administer the hepatitis B vaccine on IM injection at the anterolateral muscle of the newborn's thigh. Hi, baby. Okay. so now I'm going to proceed with vitamin K administration. So vitamin K given at birth provides protection against bleeding that could occur because of low levels of this essential vitamin. So now I have here the withdrawn vitamin K, which is on 0.5 mg. And then I'm going to wipe this site with wet cotton balls. Okay, and then discard. And then I'm going to administer the vitamin K with IM injection at the anterolateral muscle of the newborn's thigh. Hey baby, just little. Okay. Okay, so I'm going to assess for signs of bleeding. And then check the newborn's condition and vital signs. Okay, so now the aftercare. Okay, so I'm going to discard the used syringes and the used cotton balls. I'm going to place the drugs and the vaccine to their proper places. Okay, now I'm going to document the name of drug and vaccine, the time, amount, and route of administration, nurse's name and signature, other nursing intervention done, and report any unusualities to the physician or the resident on duty. Okay, so next is bathing the newborn. So bathing the newborn is to be performed after 6 hours post-delivery of the baby. So the post 6 hours of delivery is the safe time for the baby to be taken a bath to avoid hypothermia and promote extended skin-to-skin contact with the mother. Okay, so now we prepare the needed materials. So I have here basin of water, soap, washcloth, towel, comb, clean diaper, baby's cloth, and light wool with hood. So I assembled these materials beforehand so that the baby would not be left exposed or unattended while I go for more equipment. And the next is we prepare the room, and we make sure that the room is warm, which is about to 24 degrees Celsius. So now we prepare the water. It should be approximately 37 to 38 degrees Celsius for thermoregulation. Okay, so I have here now the baby. So I'm going to bath the baby, applying the principle from cleanest to dirtiest. Okay, so first I'm going to wrap the newborn's body. Okay, then I'm going to wipe the newborn's eye with clear water from the inner canthus out. And I'm going to use a clean portion of the washcloth for each eye. Okay, inner canthus out. And a different portion of the washcloth to the other eye. Okay. It is because to prevent the spread of infection to each eye. So next is to wash the face with clear water only to avoid skin irritation, and applying the principle least contaminated area to the most contaminated area. Okay, next is to wash the baby's hair with soap and water. So I'm going to hold the infant in one arm over the basin of water as you would in a football. Okay. Soap. I put soap on the washcloth. And then rinse. Okay. Rinse well. And then we're going to dry the hair well. Now we're going to unwrap the towel and wash each area of the baby's body with soap and water. Okay. So we're going to get the washcloth, submerge it in water. Okay, so we're going to wash the upper extremities first using a washcloth in a firm longitudinal stroke. Upper arm to lower arm, and the armpits and hands. Okay, then the other side, upper arm to lower arm, then armpits and palm. Okay, then we're going to apply soap. Soap and water. Now for the chest and abdomen, we're going to wash the chest using a washcloth to a circular motion towards the abdomen, avoiding the cord. Then the lower extremities, again look in a longitudinal stroke. And then the back part. So we're going to transfer the baby. Okay, so in the back, from the nape areas towards the buttocks in a firm circular stroke. And then the genitalia for females, front to back. Okay, then we're going to rinse well. Rinse well. Okay, so now we're going to pat dry the baby. Okay, so now I'm going to put on diaper. Okay, just a little baby. Dito lang. Okay, after putting on the diaper, I'm going now to cloth the baby. Hello, baby. I'm also going to put on his light wool. Hello, baby. And wrap it around the baby. Okay, so the baby is done having a bath, and he is now on his diapers and his well cloth. So I have here now the baby. So next is to do the aftercare. Okay, now do the aftercare. So I'm going to perform aftercare to the equipments used. I'm going to discard this water. And after this, I'm going to perform hand washing and doff off my gloves.